There's a new test that's being used by more and more clients and athletes called the functional movement screen. It's something that was developed to determine different imbalances or even compensatory movements that those seeking a workout or even competition would use and put themselves in greater risk for injury. So it was developed not as a tool that would diagnose issues, but would help to determine whether or not those that are performing a certain movement like a squat or a lunge are using compensatory muscles to accomplish a task. And so the tests address multiple positions and really put the body at its greatest weakness in order to determine whether or not there are issues. It's comprised of squatting, lunging, stepping, shoulder mobility, rotary mobility, and addresses whether or not there really are imbalances in the body. Once that test is used, there is a score that's attributed to each movement, and it's broken down into 4 categories: whether or not you pass without any issues, you do the test but there's a mild compensation, you do the test but there's a significant compensation, you're unable to do it, or there's pain with it. And it's after that score that a clinician, whether a personal trainer, athletic trainer, physical therapist, or doctor, would look at and determine whether or not there's a greater issue involved. Obviously, if pain is an issue, you would be referred to find out what the limitation is as far as any kind of tissue injury or restriction in the tissue itself. But if it really is just a weakness or an imbalance issue, that's where you could develop different exercises that help to correct that imbalance. It's a quick and easy tool, and it's being used more and more. And I would urge you, if you feel like you're having a pain with an exercise or just unsure how to do a certain movement and not sure about your form, it's a great thing to ask around and see if there's somebody that you know that would be able to run you through a screen and determine whether or not you're having issues. Feel free to stop by if you have any other questions about it. I'd be happy to ask you about it.